My name is Semakula David. I'm the Principal Hospital Administrator, Jinja Regional Referral Hospital. First of all, we are grateful to the government of Uganda for allocating us some development funds to work on our infrastructure challenges in Jinja Regional Referral Hospital. We received some funding from Ministry of Health, which was advanced to Updf Engineering Brigade to remodel, expand the intensive care unit of Jinja Regional Referral Hospital. Which work was done by Updf, and the background of this, during COVID, we had a lot of issues. We had so many critical patients. And this hospital serves a very big catchment area of around 4.5 million people. It is serving 11 districts and 1 city. And during COVID, we had a lot of issues, and so many patients needed critical care. And our ICU at that time was very small. It couldn't attend to all those patients. So Ministry of Health came up with a plan and advanced funds to Updf to remodel and expand our intensive care unit. Now it is a bed capacity intensive care unit, and in the same vein, there was a lot of need for oxygen in the region, and now we take oxygen as an emergency medicine. Within our existing oxygen plant, could not adequately supply enough oxygen for the hospital and for the entire region. So they have constructed for us a new oxygen plant which is able to produce around 250 oxygen cylinders in a day. And that is enough supply for the hospital and the entire region. And all these two projects have been implemented and executed by Updf Engineering Brigade. Of course, the quality of work is good, and the cost for these projects is realistic, because when you look at the cost of that the ICU, it is around 800 million shillings, Uganda shillings, which is a realistic cost when you compare the cost with the other private service providers. And this plant is around 500 million shillings. Still, when you compare with other service providers, you realize that the cost is within the reach, and when you look at the quality of work vis-a-vis the amount of money spent, there is value for money. So on that note, we are very grateful to His Excellency and the government of Uganda to come up with this innovation of having Updf Engineering Brigade to come and take over some of these projects, especially in the sector and in the education sector. So we are putting these projects to good use. Now we are able to attend to critical care patients in our ICU in the region. We are able to supply enough oxygen to the hospital and to the region, which saves a lot of lives of the people in this Busoga region.
Okay, I'm by the name Jakoma Stephen Ojaj. I'm a biomedical engineer by training, and I work at Jinja Referral Hospital as a biomedical engineer. We have been able to get a new oxygen plant which was constructed by Updf, and it has been technically handed over to Jinja Referral Hospital late last month, and the oxygen plant has been, we had the oxygen plant before, the old one, which was producing about 30 cylinders per day. But now we have the new plant, which is having a capability of producing about 250 cylinders in one day. So previously we have been having challenges of oxygen in Busoga region, because there has been a lot of need from the lower health facilities as well as Jinja Regional Referral Hospital also. And it became worse when our oxygen plant was broke down. So we had to be getting oxygen from Namamve and also roofings to support the needed oxygen, the oxygen need in the region. So we are very grateful that the new plant is operational, and we are able to supply the hospital need and also the lower facilities. So some of the lower facilities we get requisitions from Bugiri General Hospital, we get requisition from Iganga, Kamuli, Namwendwa, and also Nankoma.
My task as a project manager managing the Eastern region is to coordinate with the site engineers. And supervise the works to ensure that we are within the scope of the works, we are within the costs, and we are managing the time aspect very well. So I link the site engineers with the headquarters, and then also with our clients, the district leadership. The issues of memorandum of understanding, if there are issues with the MOU, having them fixed so that work goes on without any encumbrances. That's what I do. For Jinja Referral Hospital, we've done 3 projects. We've expanded and refurbished the ICU, and then we have also put up an oxygen plant, which is functional. If you went there, you would have seen that it's already working, producing oxygen. Those are the projects we have already finished and we handed them over. But we're also doing the perimeter fencing for a certain portion of the hospital, which was contested. But later, after resolving, the hospital decided that we fence it off. We have started that work. And we're also supposed to give them a water source, because they're saying their bills are too high. They want a situation where they can manage their utility bills. So we are going to put a production well there with all the installations, and they will be pumping water to support a certain section of the hospital.
My name is Muke Dinamarion. I'm a midwife, and I work here in Jinja Regional Referral Hospital in the intensive care unit. This is part of our intensive care unit. It has a 10-bed capacity, and I'm going to take you through what we have here. We are having an ICU bed, fully functional, adjustable to fit whichever position we shall need the patient to be on. We can operate it, we can adjust it, elevate it, whichever position and whichever level we shall need. Also with us we have the infusion pumps, which help us to deliver specific amounts of dosage for the medication for the patients as prescribed by the doctor. We have here ventilators. These machines usually used for patients who have respiratory failure and they need additional support with their breathing. So we put them on a ventilator as recommended by the doctors. We also have high flow, still for oxygen delivery. We have monitors that we use for monitoring our patients. We have also wall oxygen that we administer to our patients, and this majorly contains cables for the wall oxygen, for other equipment, and also electricity sockets for charging our equipment here. We also have suction machines at the other side of the bed. In case we don't have wall oxygen, we can still administer oxygen to our patient. We have a concentrator the other side. Mostly that is it. The patients that we receive here are majorly patients that have that need serious monitoring and nursing care and advanced interventions to sustain their lives. Those are the kind of patients we receive here. For example, patients who have respiratory issues, who have instability in their pressure, and those are mostly the kind of patients we receive here, and we monitor them. So that is it.
Last financial year, we realized some development funds from Ministry of Finance, courtesy of our line Ministry of Health, and we have earmarked some of those funds towards the construction of a perimeter wall in part of our hospital land. You know, we had issues with some land grabbers, and after we have settled all that, we decided to fence off that area. And at the same time, we have challenges with high utility bills. We have also decided as management to construct, to drill a borehole, a motorized borehole, so that we can be able to pump our own water, and we reduce on the utility costs, which are very high. We have a lot of domestic areas in terms of utilities, so we want to reduce on that, and we are requesting Ministry of Finance to offset that domestic areas for the utilities, so that we can be able to use the resources we are getting to cater for other hospital needs, and maybe also at least see we shall be able to generate water, and which will be, of course, you cannot manage this facility without water. We need water, and we need to have those two projects. I think they will ultimately lead to improved health service delivery in the region.
Engineer Jamila Namakula, nkola Engineers Brigade, mbadde site engineer oba ndi site engineer owe Jinja Referral Hospital. Tuzimbye ebizimbe ebya ICU e Jinja biri operational bikola, nenzima n'ekizimbe ekya oxygen plant nakyo kifunctioninga, kidistributinga mu districts 10 oxygen, bajja Jinja ne bacollectinga oxygen ne bamutwala mu ago amalwaliro amalala. Mu wiiki emu ngenda kuba ntandika okuzimba perimeter wall, ekisenge ekifensinga Jinja Referral Hospital. Nebaza bakama bange, the Commander-in-Chief, His Excellency, okutrustinga Engineers Brigade n'abawa omulimu ogw'okuzimba. Nebaza bakama bange, Commander wa Engineers Brigade otu entrustinga otuwa emirimu.
We have a working office, we have a staff. I am just a head of that staff. So we are managing because we have quantity surveyors. So if it requires quantification, we task quantity surveyor to do it. We have site engineers who report, they may do monthly reporting. And then we have accountants who help us to coordinate materials from the factory, because those materials we get them from the factories. Like the site engineers prepare the requirements from the drawings and the BOQs. They prepare requirements that they require. We compile them, and then we submit to the reporter, the factory order. We make an order from the factory. For example, roofings. We need this number of iron bars. They just supply. So I coordinate that in conjunction with our people, our staff. So it is a manageable task.
actually, as I said earlier on, the recommendation is good. One, you are saving on the resources. You realize that a project which would cost maybe $1 billion shillings, you can save almost half. So you can have two projects in one if you are using the UPDF, because there are some costs. They don't look into. So we are able to save some money and execute a number of projects. And when you look at the quality of their work, is also not questionable. And this is government working with government. UPDF is a government institution. Health is a government sector. So you realize that when you work with government sectors, one, you improve on the, of course, you are held accountable for those resources, and you have to offer good quality services. Two, the resources, the little resources government has can be adequately used. So the idea is good, and their quality of work so far is good. That's why even when we secured government funds, we still rent to the same institute because of their tested quality of works. So I commend them for that, and I think if they can increase on the speed of execution of their projects, and I think since they were just coming in, they are just expanding on their services to these two big sectors. To me, I think now they are coping up with the speed, and the quality is not questionable. To me, I think it is a good initiative, and I commend that.
No, we have been doing these works before. Only that we have been confined doing within our barracks, the low-cost housing, which was an initiative of the president. But now we've had a brigade, engineers brigade, with a big workforce. So the work within the barracks alone was not even enough for us. So we were many. So when these works came, it was a relief. Said now we have a capacity to expand, and then on top of that, we have continued recruiting more personnel into the army, so that we are able to cope with the task.
I would really appreciate and give thanks to the engineering team, the UPDF engineering brigade for building this wonderful plant, the structure itself, as well as the other installations. And also I will give thanks to the Ministry of Health, of course Uganda at large, for blessing the regional referrals with this new oxygen plant with bigger capacities compared to what we have previously.
Well, we, as a brigade, we have done well. If you look at the bigger projects that we have done, like the Entebbe, like the Nambole, like the administration blocks in some of the districts, they are so far very good. The only and the quality has been so good. Even when you interact with stakeholders, they have never complained about quality anywhere in the country. There has been some areas where there are some delays, which are not entirely on our side. Like I can give an example. Mbusori was delayed because of there was, first of all, delayed the evacuation of those quarters, because remember they were underused, they were being used. So when we signed the contract, the nurses and the doctors were reluctant to leave. So we wasted time over 3 months waiting them to evacuate. Same to where? Same to this area where we have just finished Busole. No, Kawolo. The same. Those ones also had refused to evacuate. It took some time. So some of these delays are the ones, and we take responsibility because we are the ones implementing the works. But sometimes even the end users are the ones who cause delays. But that's the only aspect I see. But with the the wise leadership of our joint staff engineering, he has decided to divide the management. Eastern region has to have a specific person with the site engineers, so there is that communication channel. It's going to make work easier. Western region, the same thing. Northern region and central. And in the future, we might even divide it further to ease in the work, maybe sub-regions. Like we would think of Teso sub-region, somebody in charge, Karamoja sub-region. Because some districts have not yet given us the works. They are still in the traditional way of using contractors. But they are seeing the value from other districts. Like we did some good work in Palisa. And then when these people from Kibuku district saw what we had done there, they also said, no, let's give the army. So now we have some work we are doing in Kibuku. And all these districts which are defiant to give UPDF works, as time goes on, they will see the value, the quality of the work from other districts, then they will definitely have to abide by the directive of the president and give us work. Engineers Brigade is on a very, very high trajectory. We are looking at bigger projects in the future. We are looking at going out to do the roadworks. We are looking at bridges, those big concrete structures. We are looking at going out to compete because we have the capacity. So we are just starting. We are starting, and the more mandate, because the president had given us education and health project. Now you can see in Soroti they have given us administration block. Bugweri they have given us administration block. You look at Shema. Shema we are also building four stories up of the administration block. So we are looking at going beyond this mandate we have so far to doing more bigger projects, and the future is bright. And the aspect of the equipment, I am very sure the army leadership will address it, because the equipment is what we will be now looking at. If we are to manage such a big project, we need more equipment. If it is provided, the manpower is there. This year alone we have recruited a number of people who are already in the training, qualified. So we shall have more workmanship, then we shall also need more equipment. And you know, we are also looking at the railway. The railway is already on our docket. We are supposed to work on the standard gauge railway and also improving the current sub-gauge railway. Works are ongoing by next, so we are ready to do these works.